We will now discuss sexual orientation issues. What is this sexual orientation? Whether a person has got sexual attraction towards a person of the same sex, opposite sex, or to both. How we are oriented sexually to the other person or persons. That is called sexual orientation. In general, in our world, what is more common is so-called heterosexuality, where a man will be attracted towards a woman sexually and a woman will be attracted to a man sexually. This is called heterosexuality. But there are some individuals who cannot get attracted to the opposite sex. They will get attracted to their own sex or gender. If a man is attracted sexually to another man, both physically and emotionally, he is called a homosexual. If a woman is attracted sexually, both emotionally and physically, she is called a lesbian. There are some individuals who may get attracted to both the gender. That is, a man may have attraction to another man and a woman, or a woman may get attracted to another woman and a man. This is called bisexual. There are a lot of things today. If you look at this terminology, they call it cisgender, etc. I am not going to details about these things because they are too technical and that requires by itself a separate workshop. I am talking on commonalities. People who do so many things are called pansexual. People who have absolutely no sexual attraction to any one of them, they are called asexual. Now the question is, what determines our orientation? We do not know. As of today, medical science has not definitely found out the specific causes or definitive causes for a person's sexual orientation. Earlier, there were 4 hypotheses. First one is genetic theory, where they thought in 1952 certain genes can produce this type of orientation in human beings, but that has not been proved conclusively. The second thing is hormonal influence theory, that is, imbalance of the male and female hormones when we are in the mother's womb, that causes this type of sexual attraction to same sex or opposite sex. Again, this has not been proved. Then we have what is known as peer influence theory. That is, if there is a peer group, 10 people approximately, out of the 10, 8 are homosexuals, the other 2 also will try to follow them. Or 8 are heterosexuals, the other 2 also will try to follow them. This again not proved because homosexuals may be in a heterosexual group, but still they will remain homosexuals at heart. Then we have another theory called psychoanalytic theory, whereby certain incidents which occur in childhood will pave the way for this orientation. That is, if a father is very rude, very authoritative, the mother, the child, may get afraid of the father and get despising the father and develop sympathy to the mother. And when they grow up, they automatically develop attraction to the mother, the girl, baby to the mother. Vice versa, the mother is very domineering, not allowing the father to express himself. So the boy may develop attachment to the father. So when he grows up, he may develop into a homosexual. None of the theories are proved. Today, we do not know what is the cause. Since we do not know the cause, we don't think in terms of treatment. Medical science doesn't think in terms of treatment. Unfortunately, society being the majority heterosexual, they look down upon homosexuals and get scared of them. Now, medical science have accepted them as a variant behavior or alternative sexual orientation. We do not attempt to treat them. Attempting to treat them will cause more problems because it is not a disease. It is not a disease, so it doesn't require a treatment. All that we try to do is help the concerned individual to accept his or her own sexuality, try to counsel the family to accept their child, and counsel the concerned individual to cope up with the societal discrimination. This is, in general, about sexual orientation. Section 377, till recently of the Indian Penal Code, which was making homosexuality as a punishable offense. Recently, the Supreme Court has decriminalized homosexuality as a criminal act. Unfortunately, the Parliament is yet to pass an act enabling this decriminalization. This is where we stand in India at the moment.